Okay.
Welcome to the Holistic Kid Show. My name is Zane.
My name is Imad.
And my name is Justin.
So we're the Holistic Kids here to educate us kids from the inside out.
Imad, when you go to the restaurant, what do they give for free?
Bread or processed carbs. Don't know why they just give it for free. Are they trying to fill us up? Or, well, it's not a good sales tactic.
Actually, quite the opposite. That gets your body to eat more.
What? How? That doesn't make any sense.
Well, we kids need to be informed on what is actually going on. And today, Dr. Bindiya will help us understand all of that. Dr. Bindiya Gandhi is double boarded by the American Board of Family Medicine, as well as the American Board of Integrative and Holistic Physicians. She completed an integrative medicine fellowship at the University of Arizona with Dr. Andrew Weil in 2016. She also completed functional medicine training with the Institute of Functional Medicine in 2017. She's been featured in high media outlets. She is a mother of 3 and even has her own amazing podcast called Reset, Renew, and Revive. Check it out on podcast platforms today.
Thank you so much, Dr. Bindiya. We are so honored for you to hear. You can join us today.
Thank you so much, guys. I'm so excited.
So, how did you become a nutrition doctor, like from being a traditional medicine doctor? We would love to hear your story.
Thank you so much. So I, was family medicine traditionally trained, and I'm still boarded in family medicine. But I knew very early on that there had to be another approach to health, especially when I was in medical school. I remember taking my pharmacology class, and this is a class where we learn about medications, and my professor kind of made a comment about all the medications have side effects, but they're not really side effects. That's what the medication is supposed to do. It's actually what they call the mechanism of action. And that was a very early on epiphany I had, where I was like, wait a second. So I'm going to give a patient a prescription and then they're going to come in with other medical problems. I did not feel comfortable about that. So already my mind was really interested in alternative options, but I went ahead and completed, traditional medical school, conventional medical school, and then went to family medicine. And that's when I learned more about integrative and functional medicine. And I realized that there was stuff about nutrition. Nutrition is important. And I also learned that that lifestyle was important. And so I wanted to incorporate nutrition, not only for myself, my benefits, but then also my patients. And so that's kind of where my journey evolved. And, at this time I was meditating a lot. I was exercising, doing a lot of yoga. And so it was the perfect holistic approach that I kind of fell into.
Let's start with the basics. What is leptin?
So leptin, I'm so glad we're talking about this, guys, because a lot of people know about insulin, but they don't know what leptin is. Leptin is a hormone that is produced by our fat cells. It communicates with our brain, and it actually lets us know if we're hungry, if we're full, do we need to eat more? And it's a very important hormone because for many of us, especially as we get older for various reasons, this can be the reason why our metabolism is off, and it can be the reason why we're having trouble losing weight or we're gaining weight. So leptin is a hormone that really is important, that is really not talked about, but should be.
Yeah. So how can we balance our leptin?
Yeah. So I'm so glad that we're talking about leptin because, there's so many different things that are important. So essentially, Zane, what ends up happening is when we are hungry, right? Our body will let us know that it's time to eat, right? It says, okay, it's time to eat. We're hungry, right? This is released by a hormone called ghrelin. Ghrelin is our hunger hormone. What happens when we have already eaten, say we ate lunch and we had a nice, something holistic and something healthy, like a nice, I don't know about you, but I'm dreaming of a nice gluten-free, dairy-free pizza, right? So you're eating a nice, healthy pizza that mom made or you helped mom make. And then when you eat it, what ends up happening is it tells your body that you're full. Now, when this happens, that means our leptin is technically balanced. But when we don't feel full and we've eaten like the whole slice of pizza, or we've eaten a lot more, or we're still hungry, then that tells us our leptin is not balanced. Now, ways that we can actually balance our leptin, I'll definitely get into that. But for people that may suspect that they already have leptin issues or their hormone is balanced, this could be some of the symptoms could be maybe they're hungry all the time, right? Like they're like, I just need to eat. Like every 2 hours they're hungry, right? Or they never feel full. That's one. Two, another reason. And then other times this can be happening is if they have other things going on. They've got a lot of inflammation. They've got some insulin resistance, right? They've got some blood sugar instability, other autoimmune issues going on. Maybe they've got thyroid issues. So there's multiple reasons why some of these things could be going on. Your leptin could be up. Majority of what's happening right now in our world, many people eat what we call the standard American diet, right? So this is a diet that is not very healthy. It is a diet full of processed sugars and carbs and sweets and preservatives and what is the word? Food coloring and all that other stuff. So when there's a lot of these types of foods that we're eating, it can start messing up our metabolism, and it can also be the reason why we are now becoming leptin resistant. And so our body's not getting these cues that we are full, right? Therefore, we're eating more. So how do we balance it? Now we can balance it by one of the things that I see many people in my practice clinically is a lot of people have been told a story that in order to lose weight, we need to actually starve ourselves and exercise more. So I actually tell people to eat more. And it's actually not what people think. They're like, wait a second, you want me to eat more to lose weight? And I say, yes, that is correct. And that is exactly what we do. One of the ways that we balance leptin is by actually having people eat the right type of foods in the right duration and timing so it can help balance their leptin levels.
You mentioned leptin resistance. What is leptin resistance?
So, great question. So, anybody that thinks that they may have a leptin resistant issue, one of the things I'm going to have you guys do is definitely go to my website, drbindiyamd.com/quiz, and take an 11 question quiz. Now, this quiz kind of lets us know, do you potentially have some of these symptoms? So some of these symptoms could be, like I mentioned, you're eating every couple hours, you don't get full, you're hungry all the time. For some of my older population, maybe they have blood pressure issues, maybe their cholesterol levels are off, maybe they have blood sugar instability. So some of these things can be the reason why they have leptin resistance. So those are some of the signs. But when you have leptin resistance, that means your body's not able to give your brain is not able to give your body the cues that you're full. And so you're eating a little bit more. For some people, they're having trouble losing weight. And for other people, they're also having difficulty just maintaining their weight, right? So that's what leptin resistance is.
So you have a podcast. So what does your podcast mainly talk about? Is it like lots of different stuff like our podcast, or is it?
Our podcast is probably very similar to you guys, except I'm doing it and not my kids. I should switch it up and have my 3 girls now do a podcast like you guys. That would be so cool, right? But yeah, it's called Reset, Renew, Revive, and it's on all major podcast platforms. And I love talking to expert guests. We talk about health, wellness, everything about functional medicine, what's trending. We talk about new studies. And more importantly, I just love educating and I love sharing new information, how all of us can stay healthy and happy and just live a more vibrant life. So definitely, guys, check it out.
Yeah, that sounds amazing. Even we could probably learn a lot of stuff from it too. So what habits do us kids have that mess up our leptin?
So one thing that I say that actually happens very early on, even when you were kids, right? And this is why many people end up having leptin resistance as they get older. And I actually have seen kids, guys, there's a few kids in my practice that actually our young children that are leptin resistant, right? So one of the things that that really messes up our leptin levels is actually sugar, right? So sugar is really bad, and sugar actually messes up our metabolism. It actually causes insulin resistance. Can for some people can be a reason why you are a type 2 diabetic. But sugar is probably one of the biggest things. This is our candies, our sweets. This is the fruit juices. And the biggest thing that I see, as much as I love fruit, guys, and I really encourage kids to eat a lot of fruit, what I tend to see is kids and adults are eating too much fruit. They're overdoing the fruit, and this is causing blood sugar instability, which then triggers leptin resistance.
Yeah. Yeah. So don't have too much fruit, even though fruit is like nature's candy.
It is nature's candy, but that you mentioned it. It's literally like candy. So what ends up happening is the body cannot tell the difference that if you're eating a lot of sugar or fruit sugar, right? It can't tell the difference if it's processed sugar or if it's natural fruit. And so for some people, if they're overdoing it, and I actually see this in practice clinically, I think I diagnosed 3 people literally last week with new onset type 2 diabetes, and they were healthy. They thought they were healthy, but what they were actually doing was overeating too much fruit. So, for example, I'll give you an example. They were doing like 3 or 4 fruits in their smoothies. Then they were eating fruits as snacks. They were eating fruit salad and like acai bowls and all that kind of stuff. And over time, along with other processed foods, it actually triggered inflammation, and it can actually was one of the reasons why they ended up being leptin resistant.
So when we eat junk food, it can mess with our leptin. But what
That
food can we use to keep our leptin happy?
Great question. So junk food is another one that, and I'm talking about like processed junk food, right? And even now, I want to mention this. There can be some healthy foods that can still be junk food, right? Because I see this. If it's still processed, it's processed. So like, I see people that are like, well, I eat organic, and yes, it can still be organic, but it can still be organic junk food, right? Or I'll see people that are doing well, I'm eating gluten-free crackers and gluten-free cookies, but that's still junk food, right? So we want to be mindful that we're eating healthier foods. One of the things that I highly encourage is a lot of vegetables, right? So a lot of like fresh cut vegetables, hummus and vegetables. My kids are huge fans of crudités, of vegetables with a little like tzatziki dip and that kind of thing. That's very healthy. Eating like Greek yogurt, right? And even either plain, like my kids like vanilla Greek yogurt, but that's good because it have your protein and your vegetables. And that is what keeps our leptin and our metabolism happy, keeping our blood sugar stable, keeping inflammation down, which is essentially what we want.
Well, how do you feel about like peanut butter? Is that more of a junk food or is that more of like a natural?
It's a good question. So I'm not gonna lie, I personally love peanut butter, right? I don't have an allergy to it. I grew up on it. It's one of my personal favorite comfort foods. However, it is a legume, so it's not really one of the best foods that I personally should be eating, right? Especially because I also do a lot of other things, like I do a lot of food sensitivity tests, and I also do things like blood type diets, right? So for me personally, even though I like eating it, it's not a good food for me, right? Like it actually can trigger inflammation for me. So even though I love the taste of nice organic sugar-free salt-free peanut butter, I really personally try to limit it or avoid it if possible, just because it's not good for me. But I think that to answer your question, it really is about, what foods impact everybody personally, because there's so many different things. Like, oatmeal can actually be a very healthy food for some people, but for me, many years ago, oatmeal was actually causing me a rash and some sensitivity. So when it comes to foods, I think it's a very individualized approach. It's hard for me to make proper generalizations because I don't know, is it going to help someone or hurt someone? Because they're all genetically made up differently, and they all impact us differently based on our hormones, our biochemical makeup, inflammation, and gut health, leaky gut, that kind of thing.
So, what lifestyle tips can we kids incorporate to balance our leptin? Don't stress and does stress and sleep affect our leptin?
Yes, I'm so glad we're talking about this. So sleep is so important. We need to make sure we're getting really, really good quality of sleep starting as kids and then taking those habits as we get older, because when we are sleeping really, really well, we make sure that we are what's the word? We're rested and we're rejuvenated when we wake up. That really balances our cortisol level. It balances our melatonin production. And that's essentially what we need, right? For really good sleep. So sleep is really important. But stress is equally as important too, right? Whether when we're stressed out because and so many different reasons why we could be stressed out, but managing our stress really also importantly balances our cortisol level, which then in turn balances our leptin hormones appropriately. So both are very, very important. And some of the things, I'm sure you guys talk about this too, is like lifestyle things that we can do, right? So like making sure that we take breaks and maybe we're meditating or we're praying or maybe we are just breathing, because that helps balance our cortisol level and that really balances our stress.
Yeah. So, wow. Yeah, that was amazing. So, like, how, like, is there, can we, like, get, like, can we, like, lose more? Less weight? I don't, like, understand, like, how the leptin works. Can you get more on leptin, like, how it,
Sure. So I don't want to make it too complicated or make it like too hard to understand. But for example, the way I test leptin is in a blood test, right? And that's how I kind of gauge to see like where everybody's leptin is. In a perfect world, right? I like leptin to be between 7 and 10, right? Anything above 10 plus is usually what I call leptin resistance. Anything that I call there's three different things I use. I use leptin clear, leptin sensitive, leptin resistance. Leptin clear is basically below 3. That's or sorry, I'm saying that wrong. 3 to 7, right? Is leptin clear. Leptin sensitive is 7 to 10, and then leptin resistance is 10 and above. Now, there is a point where some people have too low of leptin, right? And for that population, it really can impact bone health, right? We don't want our leptin levels to be too low. It can also impact fertility for moms or women that are trying to become pregnant. Their leptin levels are too low, and we actually work on bringing that leptin up. So it is a fine balance of making sure that that leptin is in that nice little zone where 7 to 10 is perfect. And 3 to 7 is like, okay, we're in that like tight junction, but 7 to 10 is usually a good range that we like to keep it in. But yes, I do it check via blood work. Most traditional conventional doctors, family doctors, or even what we call endocrinologists, these are hormone doctors, they actually do not check leptin. And the reason this is because it's a newer hormone. But there is lots of ways we can manage it and balance it. And sometimes, depending on the severity of leptin resistance for my adult population, I will use prescription medications to help lower it and help balance it.
thanks. Yeah, that makes a little bit more sense on, like, now I understand more of it.
So this was amazing, but let's face reality. Kids love processed carbs and sugars. All our holidays are surrounded around sugar. What tips do you have to give kids to help them stay away from the processed foods? What do you do with your kids?
So, this is absolutely true. All of us are guilty. We all have a sweet tooth. I mean, I know my kids do. So, it's really a fine balance. One of the things that I say, we can actually change our taste buds all the time. So, if we're constantly exposed to processed sugar, we want more of it. It's addictive, right? We want more. You're like, I want more. I want more. I want more. But we have to learn how to change our palate and our taste buds. And so the less we eat of it, right? When we eat a little bit, it's actually sometimes too much. So one of the things my kids sometimes will say, like especially if it's like a family member's birthday, they'll take a couple bites of a traditional cupcake, and they'll say, "Mom, I can only take a bite. It's too sweet." Because I've trained them that we don't eat a lot of sugar. So when they eat it, it's too much for them. But that being said, I don't deprive my kids of sweets because there's special occasions like birthdays that it's okay to have a little piece of cake. We just don't have cake every day, right? It's for us and our family, it's about finding that balance of what's appropriate and how much is appropriate, right? I'm also very mindful of, like, I love, my kids love Greek yogurt and just even yogurt in general. That's a good example. But I make sure that the type of yogurt that give them every day is usually vanilla plain yogurt. And then we will add a little bit of fruit to sweeten it naturally. So I will use fruit in moderation to help sweeten things naturally for our family. But they also know that we can't do a lot of other sugar. So like pancakes, when I make them pancakes, I will use some sprinkles instead of maple syrup. So sprinkles are a little bit less sweetened or have a little bit less sugar than traditional maple syrup. So we use different things so my kids don't feel deprived, but they still get a little bit of that sweetness just to kind of balance it out. I think that's really important because I don't think we should deprive ourselves, because I want them to enjoy life and I want to enjoy life and I want to enjoy foods because, as we know, especially culturally, we're exposed to so many holidays and things like that. And we want to make sure that we're enjoying food and with our families and our loved ones, but we just want to make sure we're doing it in a healthy way.
I think, yes. Wow, that was amazing. And thank you for telling, yeah. Because we also, like, we
love this.
Yeah, we also do, like, similar stuff that you do. We have, like, we still, like, enjoy, add, like, the sweetness. We have smoothies. Our mom sneaks, like, all the,
Healthy stuff.
all the healthy stuff, all the probiotics.
I know. I've seen your mom make some really amazing smoothies.
Yeah, so it still tastes good, but it has all of the nutrients.
Yes.
Yeah.
Exactly.
We also have healthier treats.
Yeah, like we also have healthier treats. Like the holiday Eid was just like
a couple weeks ago. Yeah.
And so we had some like very healthy organic treats to, like, because it was still a holiday.
Yeah, of course. Exactly. It's all about balance, right?
Yeah, we have to balance it out. After that, then we went more strict to the diet.
Yes.
So what about high fructose corn syrup?
Oh my God. I am so glad we're talking about high fructose corn syrup. So high fructose corn syrup is, again, processed fruit sugars. And this is kind of what I was like mentioning earlier. The body cannot tell the difference between high fructose corn syrup or processed fruit, because that's what it is. Fructose is fruit sugars. The body cannot tell the difference between that and cane sugar, or it cannot tell the difference between maple syrup or honey. So even though some of those coconut sugar, date sugar, sometimes everybody thinks that's healthier and more natural, which it is. But sometimes the body cannot tell the difference and it can cause havoc. So high fructose corn syrup is definitely something I highly encourage people avoid for many, many reasons. It impacts your leptin levels, impacts your blood sugars, impacts your triglycerides, impacts your liver, and it makes it hard for detoxification and causes fatty liver and blah, blah, blah. But yes, it's definitely one of the ones that I caution my families, my parents, and in our kids. We make sure that any of the ingredients that I offer them does not have high fructose corn syrup. And these days, I will say that, labeling companies, I should say, are getting better and smarter with labeling. So they will put it right on the center and say no high fructose corn syrup, which is good. So sometimes you don't have to always look back at the ingredient list to check. And there's a lot of hidden ingredients, unfortunately. when it comes to sugar, but that is definitely one you want to avoid.
Yeah. What is one thing kids can do today?
So one thing that I highly encourage kids do today, and this is one of the things that I do with my family too, because it can be very overwhelming to say, stop eating sugar, stop eating this, stop eating that. I encourage my family, my kids, and my patients to all focus on eating more protein and more vegetables. So kind of make it a positive thing and kind of saying, how many more vegetables did I eat today? Oh, I had like 2 extra vegetables today. Awesome. Or I had extra vegetables for breakfast. I had extra vegetables for lunch, extra vegetables for dinner. Yay. And then same thing with protein. How much protein did I eat today? Did I have protein at breakfast? Yep, I did. I had protein at lunch. Yep, I had protein at dinner. Protein is so important as we age, which is so good. But I also want to make sure that vegetables, that we're getting lots of adequate vegetables every day. The more colorful, the more diverse, the better for our gut health, but our immune system, brain health, and so much more.
So yeah, we talked a lot about fiber.
Did that help with our balancing our leptins?
Yes, fiber is so important. So kind of like vegetables we were mentioning earlier, when the more vegetables we eat, especially in its whole form, whether you're making in smoothies, you're mixing it up, or just, eating a lot of broccoli, it has a lot of fiber. And when we eat fiber, it keeps us full, right? Which signals our leptin to be released appropriately, keeps our hunger at bay. And it also helps our gut health. It helps with prebiotics, helps with inflammation. And guys, it helps us poop. So fiber is so good.
Hmm. So yeah. So that was amazing. Thank you for telling us all about leptin. Thanks for telling us everybody about like leptin. So we can, incorporate we can incorporate like all these new things that you've told us into like their lifestyle, our lifestyle. So where can we learn more about you and your work?
Well, you can learn everything about me at drbindiamd.com. That's where you can learn about me, and I have blog posts on there. You can definitely follow me on Instagram and Facebook at Dr. Bindiya MD. I have a quiz that you can go to if you think you're leptin resistant or just want to learn more at Dr. Bindiya MD /quiz. And then I also have a metabolism makeover course for anybody that is interested in working with me, or you can taking one of my courses, I should say. You can start and do it anytime. If you take the quiz and you realize you are leptin resistant, you want to make sure that you can do the course yourself. It's basically Atlanta Weight Loss Doctor /makeover. Do my metabolism makeover course. And then guys, if you just if your patients or people want to actually work one-on-one with me, they can definitely reach out to me on Instagram at Dr. Bindiya MD, and I can forward them to our clinic, which is Revive Atlanta MD in Decatur, Georgia. And I'm happy to see them and do one-on-one visits with them.
So that was so important. Everyone make sure to follow Dr. Bindiya on social media.
Thank you, guys. Thank you so much for having me. It was so wonderful.
So we will have the links of her amazing quiz and courses in the description of this interview. Thank you so much, Dr. Bindiya. Let's recap Dr. Bindiya's key points. Leptin is the hormone of hunger, produced by our fat cells and communicates with our brain. It tells us if we are full when our stomach starts to fill up. Fat cells release leptin to tell your brain to stop eating. When your body's constantly overloaded, it can overwhelm the system. Because of all the constant surges of leptin. Like insulin, over time, the body receptors start to turn off and become leptin resistant, and we stop listening to the leptin signal.
Just with all the hormone issues, leptin resistance is a complex issue.
With now too much leptin that the body does not respond to, leads to overreacting, weight gain, and obesity. The more artificial and processed foods we eat can lead to leptin resistance quicker, so we can continue to overeat.
This is why they give you bread at the beginning of the restaurant. The processed bread inhabits leptin. That will lead to low overeating, making your body thumb into insulin and leptin, further increasing leptin insulin resistance.
Lack of sleep, high stress levels, high fructose corn syrup, high insulin levels, overeating, inflammation, insulin resistance, autoimmune issues can all mess up our leptin. Everybody's different. What food is good for one person cannot be good for someone else. For example, too much fruit can also lead to some leptin resistance.
Eat a lot of veggies and protein that will keep your blood sugar stable. Food that real higher and fiber is eating the rainbow can all help us balancing our levels and our body that will make us feel and stop eating. Thank you so much, Dr. Bindiya. We know you are so you are incredibly honored. We know you are so busy. We are so incredibly honored. Thank you for joining us today.
Thank you.
Thank you everyone for tuning in. Until next time, I'm Zansari.
I'm Imad.
And I'm Gotham.
Follow my family and I on social media, Holistic Mama D, and look up for my mom's list. She has written a lot. Kids need to learn from other kids. Please download our podcast in iTunes and leave reviews so other kids and families can benefit. We need to work together to create a healthy future for all of us and the planet. Join us next week for another episode of the Holistic Future, where kids are empowering kids. Thank you, everyone.
Thank you,